do a little bit of that with you this morning because I want to share with you a personal experience that I had, because I was sitting in the medical staff lounge of my emergency department back in 1998 with my nurse manager, Liz Steinwatner, and I saw two nurses walk in, and they walked up to the doctor's schedule, and they went right like this, and they went, everybody here knows that that happens, right? Whether it be the OR schedule or the ER schedule. So I wasn't working clinically that day, thank goodness. But I said to her, does that happen very often? And she said, no. And I said, thank goodness. And she said, not necessarily. And I said, what do you mean? She said, well, these days the nurses have the doctor's schedules at home. They decide whether they're going to come in or not based upon who's working. And then one of my colleagues always used to say, why is it always short on the days when I work? Duh. You know, so having heard that, I said to her, well, why don't we ask the staff for feedback? If they feel that way about us, why don't we ask the staff for feedback so they can let us know how whether they like working with us or not. So if we can go back to the slides here. So we put together a survey, a 12-question survey, where we asked all the nursing staff to give us feedback. And I then went to my docs, and I said, I've got this great idea. We're going to ask all the staff for feedback. And they said, over our dead bodies. And I said, well, the truth is, if the nurses feel this way about us, wouldn't it be better if we knew it, because then we could do something about it? And they said, okay, all right. They negotiated in good faith, and they said, we'll do it. You just let us choose which of the nurses you want to give the survey to. And I said, no, we're going to give it to everybody. And here were 5 of the questions. And number 9, and I think, would you not agree that those are all important questions in terms of working together and caring for patients? And that's a real important one for an emergency physician. Would you agree? And so my expectation, we asked our staff to rate us on a 1 to 5 scale, where 5 was outstanding and 1 needs major improvement. And my expectation on this particular question was that my score, I would be about a 4.5 or a 4.6, because when we first did this, which was in 1998, late 1998, 1999. I had been practicing emergency medicine for 20 years, transcendental meditation for 30 years. I've studied some martial arts. I know what it is to be centered and grounded. And when things get crazy in my ER, my perception of myself is, I am Cool Hand Luke. I can handle it. That's my perception. So we asked our nursing staff, and in 1999, and again 18 months later in 2001, the departmental average was 3.7 on that particular score. Remains calm under crisis, it remains calm under stress and handles crises well. And I'm expecting a 4.5, and I was at 2.9. And initially, I was really quite taken aback, because you see, I perceive myself, I'm not one of those low-performing physicians. I'm a high-performing physician. That's my perception of myself. And now I was getting feedback otherwise. So I looked at, I got that feedback, and I said, well, this could not be me. So I looked at the survey form, and I thought I had it figured out. It was the way the rows and columns lined up on the survey form. They were mixing me up with Dr. Lamort. So I brought the survey form home to my wife, and I said, sweetheart, what do you think? She said, I think it's you. I said, should I make this public? She said, because I'm chairman of the department after all. She said, who gave you the scores? I said, all the staff did. She said, well, then it must be public knowledge already. Right? So this is now something that we then have something to hold people accountable to. Let's talk about behavior standards for a moment. One of the things about standards of behavior is you either have them or you don't, right? So we had a rule in my department that the phone would be answered, in my emergency department, the phone would be answered in the following manner. I'm going to go back to my experience when I practiced in New Jersey, and we'd answer it in the following way. St. Barnabas Emergency Department, this is first name, may I help you? And I called up and I heard ER. So the question is, I'm chairman of my department, medical director, do I say something? Do I say something? Of course, I have to say something, because if I don't say something, there's no standard. So I said, hi, this is Dr. Kaplan. Who's this? Oh, hi, Dr. Kaplan. This is Hazel. Hazel, the next time you answer the phone, could I ask you to answer it in the way in which we talked about St. Barnabas Emergency Department? This is Hazel. May I help you? And she said, okay, Dr. Kaplan, I'll do that. I said, let me speak with Dr. Welber. Spoke with my colleague, got done with my business. I hung up the phone. I waited 10 minutes. Verification, trust but verify, and I called back. What did I hear when I called back? I did not. Now, she probably had caller ID, you know, you know. But I gave her the benefit of the doubt, and I said, thank you so much, Hazel. And I heard a Twitter to her friends, it's Dr. Kaplan, I did well. Now, I left in April 2001. I came back in December of 2002 just to visit my friends. Guess who was working? Hazel. I went around the corner. I called. What did I hear? St. Barnabas Emergency Department says, Hazel, may I help you? I said, Hazel, you're still using the key words. Great job. She said to me, Dr. Kaplan, you've been gone from here for a year and a half, and you're still calling to check up on me. What's wrong with you? Now, I want to give you a follow-up to that, because 5 years ago, I'm doing a presentation in North Carolina. And I told that story, and somebody in the back starts waving their hands like crazy. And I said, can I help you? They said, are you talking about Hazel Simpson? There are not a whole lot of people that call themselves Hazel, right? It's Hazel, but not Hazel. I said, yes, I am. They said, she's one of the best employees we ever had. You see, we think sometimes that if we call people, hold people accountable and call people to standards, that we're doing them wrong. In fact, we're probably doing them a favor. We're helping them grow. We're helping them get better outcomes for themselves and their patients.